Good afternoon and welcome back to GP Video Podcast by Nadia. Today our topic is familial hypercholesterolemia in children. So this is a genetic condition in which there is an autosomal dominant gene that is inherited from one generation to the other and that leads in high levels of LDL. But today we are talking about it in children and I'll tell you a few points. Number one. Familial hypercholesterolemia or FH, I'll call it as FH, so just make it simple. So FH is the most common and serious condition of high cholesterol inherited, which is characterized by high LDL levels. So low density lipoproteins level. So LDL level, LDL cholesterol, low density lipoprotein cholesterol, LDL level, high levels of it. It is the most common and serious condition of inherited high cholesterol. So what are these stats? So that was number one. Familial hypercholesterolemia is the most common and serious condition of high cholesterol inherited, which is characterized by high LDL levels. Number two, 1 in 250 people in Australia are suffering from familial hypercholesterolemia. So if we just want to put it in a context, we can say that there are 100,000 people suffering from familial hypercholesterolemia in Australia, out of which 20,000 are children of less than 16 years of age. So, and apart from that, every day in Australia, there are 3 kids born with familial hypercholesterolemia. So this is a big stat, and the problem with it is that because it is, you know that high cholesterol is an asymptomatic condition. Usually, yes, it can give you symptoms at some times, but usually it's an asymptomatic condition. Yes, it can make you dizzy, it can make you feel funny and all, but as an adult, as kids, usually it's all asymptomatic. So it is an very, very highly underdiagnosed condition, and that's why the consequences and the complications are too high. Number 3 point is it is an autosomal dominant. Autosomal dominant is actually a genetic term as to how the condition is inherited from one generation to the other. So just one gene out of 2 parents can just cause this condition to happen. Number 4 is if undiagnosed and untreated. So even if it's diagnosed and not treated, or undiagnosed and untreated, it increases risk of premature atherosclerosis or coronary heart disease or heart attacks or myocardial infarction, like too much. So for example, if somebody was going to get a heart disease at 70 years of age, a male, he's now going to get it at 50 years of age. So that is like, 50% of people with familial hypercholesterolemia, which is undiagnosed and untreated in males, they are going to get a heart attack or a coronary artery event by 50 years of age. And 20%, so the percentage is lower in women, 20% of women with familial hypercholesterolemia are going to get a cardiac event by 60 years of age. So the chances increase a lot with familial hypercholesterolemia, especially if it's untreated, undiagnosed and untreated. And even if it's diagnosed and not treated, because somebody with familial hypercholesterolemia will be exposed to high levels of LDL for a long time, because it's a condition which is characterized with high LDL. Even if a person has that condition, and for example a 5-year-old has that condition, and you do the blood test at 5 years old, they are going to have high LDL, and then till the year of 50 years or 60 years, they're still going to have so much high cholesterol, and then their arteries are going to be so bad that as compared to another person, they will have heart attack 20 to 30 years before. So that is a very, very serious condition, and it is associated with significant morbidity and mortality. Again, the issue is that 90% of adults and 95% of kids don't know about it, like are undiagnosed. So usually kids are diagnosed when a parent is diagnosed with it. So when a parent is diagnosed with familial hypercholesterolemia, then the parent and the kids undergo a genetic cascade testing, which then shows that the kids have got familial hypercholesterolemia. Now, how is familial hypercholesterolemia even diagnosed in adults? Like, for example, if somebody comes to you, an adult comes to you who is not obese, who doesn't have diabetes, doesn't have high blood pressure, but still has high LDL cholesterol, first suspicion is familial hypercholesterolemia, and then we check him or her for that, and then we diagnose genetic cascade testing. And that's how then if the genetic cascade testing is positive, then we check the kids as well. But if you are doing, it could be an incidental finding in the kids. That's what happened to me when I did some blood tests on a kid who is absolutely fine. Like, we were just doing blood tests for some other reason, and I did fasting lipids as well. And yes, the LDLs are high. Now we have to do the genetic cascade testing, and we did it twice, repeated it twice. We have to do genetic cascade testing maybe on her parents. So it will be other way around in that case. But usually, because kids don't get blood tests usually, and even if they do, they usually don't get fasting lipids or fasting total cholesterol done. But if they do, and they've the cholesterol levels are high, and the kid is otherwise absolutely normal, not obese, not anything, very highly active, then familial hypercholesterolemia, especially if the LDLs are high. I'm not only talking about total cholesterol, but LDL. LDL is the main cholesterol. The other thing is, usually the treatment is diet and physical activity, but diet and physical activity usually do not lower LDL levels, and kids have to start on statins by the age of 8. We'll talk more about it tomorrow.